Hi, everyone. Thank you for tuning in today. I am going to discuss a treatment modality with roots dating back to ancient Roman times, hyperthermia. It may surprise you to learn that approximately a century ago, Dr. Coley harnessed the power of fever to combat cancer. However, as modern medicine advanced, the significance of fever in the healing process was somewhat overshadowed. Today, with the remarkable emergence of checkpoint inhibitor immunotherapy, there has been a resurgence of interest in hyperthermia as a potential immunotherapeutic tool. In the following presentation, I will take you on a journey through the fascinating history of hyperthermia, explore its methodology, discuss its major side effects, and present compelling clinical data showcasing its role in the treatment of cancer.
The information provided here is intended for general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read in this content. The use of fever range hyperthermia as a medical treatment should only be considered under the guidance and supervision of a qualified healthcare professional. Any potential benefits or risks associated with hyperthermia therapy should be thoroughly discussed and evaluated by a healthcare provider, who can provide personalized recommendations based on an individual's specific medical condition and needs. Use of mild hyperthermia or any medical treatment at home should also be discussed and approved by a healthcare professional to ensure it is appropriate and safe for your specific situation.
Hyperthermia comes from hyper, meaning rise, and thermia, meaning heat. The history of thermal therapy lies back in antiquity. Fever was understood by ancient civilizations to be the hallmark of disease, induced by evil spirits. From what we can tell from the records, the Greeks were the first to believe in the beneficial effects of fever, giving heat a holy or sacral meaning, associated with the healing powers of the sun. Ancient Greek philosophy attributed fire to the highest level of intelligence and freedom. These systemic treatments are known to have been used by ancients in China and India as well. The ancient Greeks believed that, knowing how to control body temperature would allow them to cure all diseases, as Parmenides stated in the 5th century BC, "Give me the power to produce fever, and I will cure all disease." Hippocrates, the father of medicine, believed that disease was incurable if it could not be remedied by heat. In the words of Hippocrates, who is documented as using heat to cure breast cancer, "What medicines do not heal, the lance will. What the lance does not heal, fire will." From the Greeks, the mantle of modern medicine was passed on to the Romans. The Roman author Celsus wrote the first systematic treatise on medicine, De Medicina, in which he described hot baths as a curative modality of various diseases. In the Middle Ages, there was another surge of interest in the medical fields, including the use of hyperthermia. Instruments were designed and shaped for the direct application of heat to kill tumors or cauterize bleeding. With the growing body of clinical and scientific evidence supporting hyperthermia as a cancer treatment in recent years, we have introduced this approach into our medical practice. Today, I'd like to illustrate the procedure for administering whole-body hyperthermia in our clinic. As illustrated in this slide, you can observe the final setup for whole-body hyperthermia treatment. Essentially, it resembles a sandwich-like configuration, incorporating positioned infrared heating mats, with the patient comfortably situated between them. In our clinic, we've made the decision to incorporate an infrared heating system known as the Biomat, manufactured by Richway USA. At the core of Richway's Biomat technology, you'll discover a harmonious blend of three extraordinary elements that promote overall health: far infrared rays, negative ions, and the conductive properties of amethyst crystals. These three powerful components synergize to create a single, user-friendly unit. As part of our treatment protocols, we use two distinct sizes of the Biomat. The first is the professional-sized Biomat, with generous dimensions, thoughtfully placed atop the treatment bed, to ensure comprehensive coverage. Additionally, we harness the therapeutic potential of mini-mats, of smaller size, positioned on the patient's body, to adapt to their unique contours, and maximize the therapeutic benefits. We have also explored an alternative to the Biomat, namely the Metacrystal Amethyst V-Mat. Patients have reported a comparable therapeutic experience with this option. Notably, it possesses excellent build quality, while presenting a more cost-effective solution. This offers a compelling alternative for those seeking both quality and affordability. First, you'll want to put the professional-sized biomat right on top of the treatment bed. Then, have the patient lie down on it and get themselves into a comfy position. We want to make sure patient's heart stays safe, so we do something really important. We take a thick towel and put it over the left front part of chest. This towel acts like a shield, protecting that sensitive area from direct exposure to the infrared heat. It's a simple but crucial step that guarantees heart safety throughout the entire heating process, making sure patients feel secure and comfortable. In the picture, you can clearly see how we've set everything up. The patient lies down on the big biomat, and then we place 2 to 3 smaller biomats on top of them, shaping them to fit the body contours for the best heating effect. To make sure the patient stays warm and retains the heat, we also add an extra layer of blankets. Next, we'll get the system up and running. Start by turning on the power and control. Initially, set the control to the maximum heat level, and then you can make adjustments as needed once the patient reaches their desired core temperature. Throughout the treatment, we closely monitor vital signs such as temperature, respiratory rate, heart rate, and blood pressure. It's important to note that fever serves as a protective mechanism, and once the body temperature hits 101.3 degrees Fahrenheit, 38.5 degrees Celsius, the immune system goes into an alert state. At this point, the levels of immune chemicals in the bloodstream double, and the body's overall immune defenses increase. Interestingly, many cancer patients have never experienced a fever, indicating a dormant immune activation process. To reawaken the immune system in these cases, we aim to achieve total body hyperthermia within the fever range, heating the entire body to around 101.3 degrees Fahrenheit, 38.5 degrees Celsius. This approach is essential for reaching a therapeutic fever range, unlike conventional methods such as saunas or hot tubs, which don't affect core temperature or achieve the required fever range temperatures. It may take 1 to 2 hours to raise the body temperature from the baseline of 37 degrees Celsius to 38.5 degrees Celsius. Once it reaches 38.5 degrees Celsius, we'll adjust the heat control to maintain a temperature between 38.5 degrees Celsius to 40.5 degrees Celsius for less than 3 hours, often keeping patients in this range for 1 to 2 hours. If the patient ever feels uncomfortable, if their heart rate exceeds 130, if oxygen levels drop, or if blood pressure becomes too high or low, we'll promptly stop the heat. After completing the treatment, we'll allow the patient to cool down for approximately 30 minutes. As per guidelines from the German Society for Hyperthermia, there are 3 distinct levels of whole body hyperthermia, or WBH, each with specific temperature targets. First, we have mild WBH, where the goal is to raise the body core temperature up to 38.5 degrees Celsius. The treatment time is divided into 2 intensity levels, a short duration of less than 30 minutes and a longer one exceeding 30 minutes. Then, there's fever range, or moderate WBH, which involves increasing the body core temperature to target temperatures, ranging from 38.5 degrees Celsius to 40.5 degrees Celsius. Similar to mild WBH, the application time is split into 2 levels, a short duration of under 180 minutes and a long duration extending beyond 180 minutes. Lastly, extreme WBH is reserved for temperatures exceeding 40.5 degrees Celsius, necessitating anesthesia, and not recommended for immune activation. Fever range WBH is particularly intriguing in the realm of modern oncological treatment, due to its well-tolerated nature, making it a potentially valuable addition to current therapeutic strategies. Fever range whole-body hyperthermia exhibits multifaceted effects in the field of oncology. Firstly, it reduces interstitial fluid pressure within carcinomas, leading to heightened tumor perfusion, and improved oxygen supply, consequently reducing tumor hypoxia. Hyperthermia also amplifies the effectiveness of radiotherapy. Notably, these changes persist for up to 24 hours after hyperthermia application. Computed tomography scans further affirm a significant and sustained increase in tumor perfusion immediately following hyperthermia, lasting for 5 days. In terms of the immune system, hyperthermia plays a pivotal role, enhancing cellular and humoral immune responses. It boosts natural killer cell function, facilitates cytotoxic T cell migration to tumors, and bolsters the activity of macrophages and dendritic cells. Crucially, preclinical studies underscore the potential of fever range hyperthermia to promote anti-tumor immune responses, without causing harm to normal tissue. Furthermore, small-scale trials indicate long-lasting antidepressive effects of single-session hyperthermia in patients with major depressive symptoms, which is especially relevant in the context of cancer care. Additionally, studies suggest hyperthermia may alleviate symptoms of fibromyalgia, offering relief to advanced stage cancer patients, who frequently experience pain. Lastly, hyperthermia's impact on the gut microbiome, known to influence responses to conventional cancer therapy and immunotherapy, presents an intriguing avenue for further investigation in oncology. Professor Atonikovic conducted extensive research on hyperthermia and immune activation during his time as a research fellow in tumor immunology at the Ludwig Institute for Cancer Research at Memorial Sloan Kettering Cancer Center in New York City. He currently holds the position of medical director at the Fanny Angelos Cellular Therapeutics Laboratory at the Green-Ebaum Cancer Center. To investigate the impact of a 60-minute treatment with 41.8 degrees Celsius whole-body hyperthermia as an adjunct to chemotherapy on T cells, blood samples were collected at various time points, before and up to 48 hours after the treatment. The results were quite remarkable. Immediately after the 41.8 degrees Celsius hyperthermia treatment, there was a significant increase in peripheral natural killer cells and CD56 positive cytotoxic T lymphocytes in the patient's peripheral blood. These levels returned to baseline at 5 hours post-treatment. Additionally, there were notable increases in serum levels of tumor necrosis factor alpha, TNF-alpha, immediately after treatment, lasting up to 24 hours post-treatment. This study provides compelling evidence for the extended activation of human T cells induced by combination of hyperthermia and chemotherapy, a phenomenon not observed in patients receiving chemotherapy alone. Dr. Crable and his team from the Division of Surgical Oncology at the Roswell Park Cancer Institute in Buffalo, New York, embarked on an early study to investigate the safety of hyperthermia in cancer patients. For this purpose, patients were subjected to controlled heating using the Heckel Height 2000, a device designed specifically for this application. The patients were divided into 3 groups, each comprising 3 individuals, and their temperatures were diligently monitored throughout the procedure using a transrectal temperature probe. The fever range whole body hyperthermia treatment showed excellent tolerance among all the patients. There were no adverse events reported in patients treated for 3 hours. However, among the 3 patients who underwent a 6-hour session, 1 developed small blisters, but these did not lead to any serious health issues. 2 of those patients described feeling restless during the treatment, but we managed this by providing increased sedation. Additionally, these 2 patients experienced frontal headaches after the 6-hour FRWBH treatment, which we successfully addressed with acetaminophen. It's worth noting that adverse effects of hyperthermia, such as skin burns and skin pain, are generally mild and tend to heal on their own. Whole body hyperthermia can be a bit more invasive, causing sensations of heat, tiredness, and reduced sweat due to rapid core body temperature elevation. However, it's crucial to consider individual health factors, as conditions like dehydration, heat illness, cardiac disease, or thrombosis may arise depending on the patient's underlying health. Therefore, this method is not recommended for patients with neurodegenerative diseases, such as multiple sclerosis, heart failure, brain tumors, a history of seizures, or uncontrolled hypertension. Overall, hyperthermia is a valuable therapeutic method when used appropriately and with careful consideration of individual health profiles. Hyperthermia can indeed cause an increase in heart rate, sometimes reaching up to 130 beats per minute. However, it's important to note that despite this rise in heart rate, the blood pressure tends to remain stable. This means that while your heart is working a bit harder due to the increased body temperature, your blood pressure generally stays within a safe and manageable range. Professor Joan Bull from the UT Health McGovern Medical School conducted a groundbreaking study, based on a regimen originally developed in a preclinical tumor model. This innovative clinical protocol combined fever range whole-body thermal therapy, involving 6 hours of exposure at 40 degrees Celsius, with the use of intravenous chemotherapy, cisplatin, gemcitabine, and interferon alpha. The study represents a significant step forward in exploring the potential benefits of hyperthermia in conjunction with established cancer treatments, marking an exciting development in the field of medical research. In this study, a significant number of patients, specifically 41% of the 37 individuals on the protocol, documented partial responses to the treatment, showing its effectiveness. Additionally, 19% of the patients experienced stable disease, further highlighting the therapeutic potential. The mean overall survival stood at 8.1 months, but what's truly remarkable is that some patients exceeded this mark, with a few even surviving for over 40 months, underscoring the encouraging outcomes. The protocol, which included cisplatin, was well tolerated and notably enhanced the quality of life for those who positively responded. What's particularly noteworthy is that the treatment demonstrated anti-tumor activity in patients with advanced metastatic solid tumors, even in cases where the malignancies had previously progressed on the same chemotherapy drugs used as standard treatment without hyperthermia. Notably, excellent responses were observed in patients with high-grade neuroendocrine and pancreas cancers, emphasizing the potential benefits of this approach in challenging cases. As I mentioned earlier, Dr. Bull's team observed excellent responses in patients with high-grade neuroendocrine cancers, which included small cell lung cancer and pancreas cancers. These findings underscore the potential effectiveness of the hyperthermia treatment, particularly in cases where high-grade neuroendocrine tumors and pancreatic cancers pose significant challenges. It's promising to see positive outcomes in patients facing such complex and aggressive forms of cancer. In the UT Houston study, 7 patients facing metastatic pancreas cancer participated in this groundbreaking thermochemotherapy trial. What's particularly noteworthy is that 6 out of these 7 tumors had previously demonstrated resistance to gemcitabine or a combination of gemcitabine and cisplatin. In other words, these tumors had continued to progress while being treated with these chemotherapy drugs at normal body temperature. However, despite the initial resistance, the results were quite remarkable. 5 of the patients exhibited partial responses to the thermochemotherapy, with durations ranging from 6 to an impressive 13 months. Additionally, 1 patient experienced stable disease for a duration of 4 months. These findings offer new hope for patients facing the challenges of metastatic pancreas cancer and underline the potential benefits of this innovative approach. Remarkably, in this study, 1 patient with small cell lung cancer, alongside 5 patients facing progressive high-grade neuroendocrine cancer, witnessed an astonishing 40% partial response rate. An even more astonishing case emerged in a 66-year-old patient who had chemotherapy-resistant small cell lung cancer, with metastases in the lung, liver, and bone. Against the odds, this patient experienced a complete response to the treatment. She remained disease-free after 4 treatment cycles, and eventually passed away from unrelated causes, marking an impressive 3.6-year survival after her last thermochemotherapy treatment. These outcomes shed light on the potential efficacy of this innovative approach, offering renewed hope and possibilities for patients battling challenging cancers who developed chemotherapy resistance. Dr. Honeck from Heidelberg University conducted a retrospective analysis to investigate the impact of hyperthermia alongside palliative chemotherapy in patients with advanced pancreatic cancer, all treated at a specialized institution focusing on integrative oncology. The study included a total of 206 consecutive patients, with 142 of them undergoing palliative chemotherapy, such as gemcitabine, nab-paclitaxel, FOLFIRINOX, or gemcitabine, while the others received best supportive and integrative care. Notably, mistletoe was integrated into the treatment of 117 patients, and hyperthermia was used in 74 patients. Those receiving chemotherapy alone survived for an average of 8.6 months, whereas patients combining chemotherapy with mistletoe therapy achieved 11.2 months, and those using a combination of chemotherapy, mistletoe, and hyperthermia showed an impressive 18.9 months of survival. These findings highlight the significant improvement in survival when incorporating mistletoe and hyperthermia into the treatment regimen for advanced pancreatic cancer patients. Dr. Kleef from Austria has been making significant strides in the treatment of advanced melanoma and other solid cancers. Currently, the 3-year overall survival rate for patients with stage 3 or melanoma has reached an impressive 63%, thanks to ipilimumab and nivolumab therapy. However, this approach did come with its challenges, as 59% of patients experienced grade 3 or 4 immune-related adverse events, leading to treatment discontinuation in 24.5% of cases. Dr. Kleef's innovative approach involved using lower-dose immunotherapy in combination with hyperthermia. This novel combination therapy included locoregional hyperthermia and whole-body hyperthermia, individually dosed interleukin-2, along with low-dose ipilimumab and nivolumab. The treatment approach for these patients was quite comprehensive and innovative. They underwent loco-regional hyperthermia sessions, using a radiofrequency device, 3 times a week for 60 minutes over 4 weeks, targeting the tumor area for a total of 12 treatments. Additionally, they received long-duration whole-body hyperthermia, under light sedation, once a week before IL-2 therapy, coupled with a moderate dose of cyclophosphamide, to modulate the expected upregulation of regulatory T cells. The therapy also included IL-2 to induce fever therapy and boost the immune system. Furthermore, 3 times a week, patients received high-dose vitamin C intravenously, at 0.5 grams per kilogram of body weight, and alpha-lipoic acid at 600 milligrams. This comprehensive approach aimed to provide a multifaceted strategy for treating these patients and enhancing their chances of recovery. These patients exhibited a combination of unfavorable features, including a significant 24% use of antibiotics, low PD-1 or PD-L1 expression, and an exclusive group of stage 4 patients, with 35.1% having liver metastasis, which generally carries a poor prognosis. Additionally, only 35% of them had a good ECOG performance status, and they were heavily pretreated. Despite the challenging circumstances, the outcomes of their treatment have been remarkably promising. The results showed a 31.3% objective response rate, a solid 10 months of progression-free survival, and a 24-month survival probability of 36.6%. Remarkably, the adverse events were minimal, with only 2.29% of patients experiencing grade 4 side effects, suggesting that this combined treatment not only maintains its efficacy but also offers a safer profile when compared to established protocols. In conclusion, fever range hyperthermia has emerged as a safe and promising treatment option, whether used alone or in combination with chemotherapy and immunotherapy. This approach has shown the ability to reverse drug resistance, enhance treatment response, and improve overall survival rates while also allowing for reduced doses of immunotherapy, thereby minimizing potential side effects. It's important to emphasize that when employing hyperthermia, careful attention must be paid to temperature and duration, necessitating close medical monitoring and supervision to ensure its safety and effectiveness. On the other hand, mild hyperthermia of short duration has demonstrated safety for at-home use, providing patients with a more accessible and convenient option for their treatment journey. Thank you for your attention today. If you have any further questions about hyperthermia or any other related topics, please don't hesitate to reach out to Omega Precision Oncology Clinic. Our commitment is to provide cutting-edge cancer treatments combined with compassion, expertise, and competence. We understand the challenges you and your loved ones may face during this challenging period, and we are dedicated to offering unwavering support every step of the way. At Omega Precision Oncology, we take immense pride in delivering specialized services that encompass tailored and personalized cancer treatments with a holistic approach. This includes nutraceuticals, off-label medicines, high-dose intravenous vitamin C therapy, hyperthermia therapy, and a range of other advanced treatments designed to optimize your care and well-being. Your health and journey towards recovery are our top priorities, and we look forward to being a steadfast partner in your fight against cancer.
The information provided here is intended for general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read in this content. The use of fever range hyperthermia as a medical treatment should only be considered under the guidance and supervision of a qualified healthcare professional. Any potential benefits or risks associated with hyperthermia therapy should be thoroughly discussed and evaluated by a healthcare provider, who can provide personalized recommendations based on an individual's specific medical condition and needs. Use of mild hyperthermia or any medical treatment at home should also be discussed and approved by a healthcare professional to ensure it is appropriate and safe for your specific situation.